Thank you for joining us for this important, urgent, and timely conversation, the long overdue fight to end pregnancy discrimination. For the last 15 years, A Better Balance has represented and advocated alongside workers whose employers have refused the most basic accommodations on the job during their pregnancies. We have worked alongside these brave women to launch a movement seeking justice for pregnancy discrimination, changing laws across the country and urging Congress to take action. This year, we have an incredible opportunity to finally pass the Pregnant Workers Fairness Act, which would provide long overdue legal protections for pregnant workers, especially Black and Latina women in low wage and physically demanding jobs. I am thrilled to have this conversation today with leaders and advocates for pregnant workers to discuss this problem, the impact on pregnant workers, and the need for the Pregnant Workers Fairness Act, led by Representative Nadler and Senator Casey. I am pleased to be joined in conversation by Representative Lucy McBath, who represents Georgia's 6th Congressional District in the House of Representatives, Tasha Murrell, a Better Balance community advocate and Teamsters organizer, and a former warehouse worker in Tennessee, Hannah Bronfman, author, health and wellness entrepreneur, and on-camera personality, and an outspoken leader raising awareness of maternal health and gender equity issues. And my name is Elizabeth Gedmark. I'm a vice president and based in our Southern office in Nashville, Tennessee. I've worked on advocacy for pregnant workers, among other issues, for nearly 10 years at A Better Balance. So thank you all so much for being with us. And now I will introduce, to kick things off for us today, Representative Lucy McBath, member of Congress and legislative champion for the Pregnant Workers Fairness Act, among many other important issues. Thanks so much, and I'll turn it over to you.
Well, thank you, and hello to everyone. A Better Balance. Thank you so much for hosting this panel today. And thank you to our moderator and Vice President Elizabeth Gedmark, and my fellow panelists, Hannah Bronfman and Tasha Murrell, for hosting me today. The health and wellness of pregnant women is such an important issue, and it's crucial for us to have these conversations in order to prevent more women from facing pregnancy discrimination in the workplace. Like many women in America, my story includes a struggle to get pregnant. When we finally succeeded, my husband and I, it was truly a miracle for me and my family. And after suffering several complications with my pregnancy, my doctor insisted that I stay home from work to protect the health of myself and my baby. Though I was lucky to be able to stay at home and rest safely during my pregnancy, this is not the case for every pregnant woman. Christina, a nurse in Georgia, where I live, requested that due to her pregnancy, she receive help lifting patients, be allowed to use an N95 mask when interacting with COVID-19 patients, or that she be allowed to transfer to another department. And unfortunately, her requests were denied. Without the accommodations she needed to maintain a healthy pregnancy, she was forced to actually quit her job. So it's so vitally important that mothers like Christina receive quality healthcare during their pregnancy without the risk of discrimination. Amidst a global pandemic, which has forced millions of women to leave the workplace or risk their health, we should be doing everything that we can to help pregnant workers stay healthy and attached to the workforce. And I am proud to be a co-lead of HR 1065, which is the Pregnant Workers Fairness Act, which actually establishes a pregnant worker's right to reasonable accommodations in the workplace, because no mother should ever have to choose between the health of themselves and their child or their paycheck. The Pregnant Workers Fairness Act is widely supported across the United States and the country, and passed in the United States House of Representatives with overwhelming bipartisan support. And we did that last Congress. So I remain hopeful that we'll be able to pass it again in this Congress, the 117th Congress. Unfortunately, discrimination at work is not the only problem that pregnant women face in America. The United States has the worst rate of maternal death in the developed world. And my home state of Georgia has the second worst rate of maternal death in the country. And for Black women in America, the rate of maternal mortality only increases. This is absolutely unacceptable. And there's no reason that the richest nation on earth, why we cannot keep our mothers and our families healthy and whole. That's why just this past February, the Black Maternal Health Caucus, of which I am a member, reintroduced HR 959, the Black Maternal Health Momnibus Act. This is a very comprehensive piece of legislation that really helps fund the critical services and research that we need to save the lives of American mothers. The Momnibus includes the Social Determinants for Moms Act, which I introduced. This legislation marshals all the resources of the federal government to ensure that we are taking a holistic approach to the health of our mothers and their babies. I was also pleased to see portions of the MAMA Act included in the American Rescue Plan, which we just passed. And this legislation will provide a full year of pregnant and postpartum Medicaid services for new mothers who rely on this very crucial program. It also provides new incentives for states to expand Medicaid, providing a lifeline to rural hospitals and essential care to millions of Americans. I'm so proud to support these efforts and pieces of legislation, and we must work to ensure that women are healthy and safe. That is not a privilege, that's our right. And not only during our pregnancy, but also in the months and the years after. The time is now for us to take action. We cannot continue to let our moms and our families suffer. So I wish I could join you for the rest of the program today, but please understand that I am so grateful to each of you for the work that you're doing. I'm so sorry that I have to hop off soon, but thank you again for having me today and for holding space for this very, very necessary and critical conversation. And be well.
Thank you so much, Representative McBath, for sharing your personal story as well as for your championship of the Pregnant Workers Fairness Act, along with so many important issues. We just can't thank you enough for taking the time, and we know that you have to hop off for important congressional business. We certainly understand that. So thank you so much again for joining us.
Take care.
So now I'd like to turn to Tasha and Hannah and ask you both some questions about your experiences and your advocacy. The Pregnancy Discrimination Act was passed 40 years ago, yet pregnancy discrimination is a pervasive problem. When we talk to people in our advocacy, it is often a surprise that workers are discriminated against in this way. Tasha, you have been a leading advocate on this issue and have your own personal experience with pregnancy discrimination. Can you share your story of what happened to you in the warehouse when you were pregnant?
Yes, ma'am. Again, thank you all for having me. Well, I did suffer a miscarriage in a warehouse of XPO Logistics here in Memphis. Not only me, I definitely don't want to leave out the other women. It was numerous of women that lost their babies in this warehouse. So I definitely don't want to leave them out, and definitely don't want them to be counted in. I fight, Miss Elizabeth. I continue to fight because I do not want, other women to lose their babies, to go through the things that we went through. I definitely will continue the fight because, again, I mean, all we asked was a little accommodation, for a little while. We weren't asking, anything, wild or anything. We just wanted, just a little accommodations just for a little while.
So take us back to that day, if you don't mind. What happened?
Sure. I mean, it's it's still hurtful. I mean, my child would be going on 8 years old, and it's hurtful. It still hurts me and my family because they were here when I was going through my miscarriage and everything. So they saw, my hurt, my blood, my sweat, my tears. And also, they saw how that I work. I continued to work because I had to work, to help provide for my family. So, I mean, it's still hurtful. I mean, I asked for, um, you know, just that particular day I wasn't feeling well. I had told my supervisor that I wasn't feeling well, and she knew that I was pregnant. She even told me to have an abortion because I didn't need any more children. And that really hurt. I mean, that really hurt coming from a supervisor, but I've saw in the past that, I mean, the way that they did other women, that I wasn't going to be special. So, I continued to work. But that day I just wasn't feeling well. I went on and took a half a point because I had to go home. And it's either was a whole up, that point, or me just quitting the job. So I just went on and took that point and went home. And earlier part of the next day, getting up, I started suffering my miscarriage that morning. And so, me getting my kids up ready for school, me and my husband, my husband called in from work because he knew something was wrong because, you know, blood was like everywhere on the mattress. And so I got on up, hurting and paining, and went on to the emergency room for the doctor to tell me that it's nothing that he could do for me, that I would have to, go home and pass it, on my own. So I did just that. They gave me pain medicine and whatever, but I went home, and my baby eventually passed through me. It eventually passed, and I mean, and I've been going forward, just trying to make it, and to advocate for other women so that another child will not be lost just because a woman needed to help take care of her family.
Thank you so much, Tasha. Thank you so much. And I
I'm
can,
sorry. I still get emotional. I mean, because I mean that was my baby. That was a part of me, so excuse me. Right.
no need to apologize. Please do not apologize. It's an emotional issue, and we're so grateful that you would share that part of you with us today and recognize how traumatic still it is to discuss, and the fact that you had to go through that, and all you were asking for was some reasonable accommodations from your employer. Um, it's just so powerful. So thank you. Um, Hannah, I want to turn to you and bring you into the conversation. The consequences of pregnancy discrimination, as we've just heard, are devastating, from pushing pregnant workers into poverty to resulting in serious health complications. You have been outspoken on a range of social justice issues and have prioritized vulnerable, often taboo conversations about pregnancy loss, maternal health, and the realities of motherhood. What sparked your passion for these issues, and how does ending pregnancy discrimination intersect with these issues?
Well, first off, I just wanted to say thanks so much for having me today. And Tasha, thank you so much for sharing your story. It's, I can relate to losing a baby, and it doesn't get any easier. And so thank you for being so vulnerable and honest. Um, so for me, a few things sparked my interest here. I in college had a friend who was working with Every Mother Counts, and she, at the time, this was over a decade ago, was traveling a lot to different countries around the world and seeing firsthand how detrimental the conditions were that these women were um, having to give birth in, and a lot of these women were not making it through their deliveries. It was a really it was a really harsh introduction to childbirth. And then I realized, obviously, that that was happening in countries around the world. What was happening, it sparked my interest to find out what was happening here in the United States. And then my own journey of trying to get pregnant was definitely part of the catalyst as to why I am advocating for maternal rights. I had my own slew of complications, and it took a long time for us to get pregnant. And when we suffered our miscarriage, I felt so alone, yet it's such a common thing to happen. 1 in 4 women will experience a miscarriage. And I felt like it was much more difficult to suffer in silence than it was to be vocal about everything. And I do have a platform on social media. And so I wanted to use it to draw attention to the issues that so many women face, because we have, historically been silenced. And if there's one thing that, women have learned over the last, I don't know, 5 or 6 decades, it's that our voice matters and it should be heard, and that we all need to band together to lift each other up. So that's kind of what sparked my attention to this issue. And then when I was pregnant during the pandemic, I was starting to hear a lot of stories about, the Black mortality rates and stories of individual women who were not making it through childbirth. And it became my own personal kind of crusade to talk about it and try to understand where the disparities lie, why in New York State alone it is 12 times more likely for a Black woman to die during childbirth or due to pregnancy complications. I do not understand. New York State is one of the most, forward-thinking, well-funded states, and there's, only a few real answers, and that comes down to discrimination. And I've been able to work and reach out to organizations who do stuff about advocating and education and giving access to women in lower income communities, because I think also what's happening is that a lot of women who are hearing these stories, because the media loves to tell them, especially to instill fear, these women are fearful about going into the hospital, and therefore that can lead to more complications. So I've been able to pinpoint a few organizations who do a lot of work around education and access, and have community doula programs, and are able to give out care packages and products and pamphlets. And a lot of the complications that happen during pregnancy are preventable. So how do we take a proactive stance and be on the flip side of this and help prevent some of these things from happening? So yeah, that's a little bit about what sparked my journey and why this is something that I really am passionate about. And I'm just trying to share the knowledge and education and awareness to my community.
Yeah, and thank you so much for all that you do, and thank you for sharing your personal story with us here today, and for so many, and really giving voice to something that is so often suffered in silence, as you said. I also wanted to thank both of your families. I'm sure they're watching, for the support, because it really can affect a whole family too, as you were talking about, we and our. Tasha, I wanted to ask you another question. So through A Better Balances Helpline, we hear the devastating economic consequences of women who have been denied pregnancy accommodations, pushed off the job, losing health insurance, and having to go into debt just to feed and clothe their families. So, would you speak even more about why you decided to get in the fight to end pregnancy discrimination and the progress that you've made so far, like with Tennessee's new law?
Oh, yes, ma'am, absolutely. Um, working alongside Better Balance, I hope my story is inspirational to the lawmakers that passes the bills. Shout out to you, Miss Elizabeth, Better Balance, for all the fighting and the help that you do for the community. And also many, many years of fighting. And we're fighting for federal laws with the ABB so that no one else will go through the things that we went through. We fight for racial, gender, and economic justice. In the light of this COVID, pregnant women need accommodations now. I mean, they need it's a matter of life and death. And I will not wish this on my worst enemy. These companies need to be held accountable for what they're doing. I mean, they make their billions and millions on the back of the workers, majority of women, and the women of color. I mean, we need, women just are forced to just do day-to-day basic things that are taking care of themselves and taking care of their families, and also to secure and provide for their family. And all, the companies that are making the billions and millions and billions of dollars on the workers' back, they should be able to have some accommodations, and we need those bills passed immediately. Not only, for women, we look out for the men, because the men are going through the same thing that we're going through. They may have to take off work as well, to help their, women go through so much, having children, miscarriages and everything. And we need our husbands there to support us. So not only fighting for us, fight for their rights too, to be able to take off work or to take care of their children if their wife or spouse is deceased or unable to take care of the family. I mean, it needs to be set in law now. We need safety nets and security now to protect pregnant workers, women that's working in these warehouses, working on these jobs, just for a little while. We're not asking for drawn out long years of help. We just need accommodations for that meanwhile to take care of us as well as our family.
Absolutely. I completely agree. And I mean, going back to what you were saying, Hannah, that so many of these maternal health issues are preventable. So to have a law, I mean, if you have something like a water bottle, then you can prevent a urinary tract infection, stay hydrated, and that can be linked to really serious health complications, maternal health complications. And how is it that we're sitting in the United States and there are these preventable health complications that we still don't have clear laws to actually support? So I wanted to ask you, you brought up COVID, a little bit more about that. The COVID pandemic and resulting economic recession has an outsized impact on mothers and women in the workplace, especially mothers of color. And it's been well reported that the pandemic has resulted in women leaving the workforce at unprecedented rates, largely due to caregiving responsibilities. And we often talk about the motherhood penalty, but that starts at pregnancy and the pregnancy penalty. Hannah, I know you are a big fan of history. How do you think the pandemic has shaped these conversations and perhaps altered the course of history for mothers, or anything that we can do to change that arc of history?
Well, I think that right now people have never been more responsive and alert and in the know, and frankly, like glued to media. Because of COVID, we've all kind of, everything is based around our phones and our computers, and we are consuming media at a insane rate. So I think that, it's the time is now to be as vocal as possible. We can't wait for more tragedies to hit in order for there to be serious change. That's why when Representative was saying how it just passed in Georgia, and obviously Tasha was saying there's a new law in Tennessee. It is so important that we have women like yourself, Tasha, who are going out to advocate, because for instance, what I do, I can spread awareness on social media, but I'm not the one who's working at a grassroots level, going to the lawmakers and saying this is what needs to happen, right? Like, there are so many, and I think that's a part of the pain point in creating change, is this chain of command, and how many hands it needs to touch before it gets to the place where it actually is going to make a difference. But each part of that chain and that touch point is so important. So the work that I do is very different but important than the work that Tasha does. And it's all, cyclical in reaching that overarching goal, because at the end of the day, we all know and value how important the female role is in society and in bringing in life and holding up the household, all of these things. Yet we're treated like second-class citizens. So, I think at this point, I feel like Black women, especially through the pandemic, through Black Lives Matter movement, really the resurgence of it, we are exhausted, but we are not given the opportunity to rest, because these issues don't have time for rest, right? So as exhausting as this all is, to continuously share our stories, as you saw from Tasha and both my experiences, this is painful work. We don't want to continuously talk about what happened to us. That's painful, that brings up trauma. But if our story is going to help push this narrative that we all desperately need forward, then we have to continue doing that work. So, people talk about life not being fair. And, I think when we talk about privilege and all these things, it's a privilege to not have to say anything. It's a privilege to be able to sit back and think that someone else is going to do the work for you. So it's just a part of, at least what I think, it's just a part of my duty to continue expressing what I think is, again, a right and not a privilege.
Yes, I completely agree. And thank you so much for naming that, both in terms of naming the trauma, that it is not easy, which is why I'm in such awe of both of you, and that we do need both types of advocacy in terms of grassroots and then the important work that you're doing. I completely agree. And actually, it feeds into a question I was going to ask about racial justice. Over the last year, we have seen heightened awareness of issues related to racial justice. And like so many issues, pregnancy discrimination has a disproportionate impact on Black women, who not only face higher rates of pregnancy discrimination, but are also overrepresented in the frontline work that can make them vulnerable during their pregnancies, and who hold serious financial responsibilities, as they statistically are often the breadwinners in their families. We need so much to achieve racial justice. There's just so much there. Why is this issue of fighting pregnancy discrimination a priority right now? And this is a question for either of you. I'd love to jump in or expand on what you were already saying, Hannah.
Can you repeat what you just said, Elizabeth? I'm sorry.
Oh, no, that's no problem. So in the last year, we have seen this heightened awareness in terms of racial justice. I would add, I think that we've also seen this elevation, this recognition of Black women's leadership, but then at the same time, oftentimes only paying lip service to that and not really being true in terms of actually valuing what that leadership means and what it looks like and how traumatizing and exhausting it can be. So, there's so much that is needed to achieve racial justice in our country. We have so far to come. Why do you think that this issue should be, one of the many priorities in terms of addressing racial justice, the issue of pregnancy discrimination?
Well, Miss Elizabeth, I feel proud because this year alone, I've seen so many women stand up to hold the seats, the senates, the congressmen. I mean, and it's kudos. I mean, because women we make the world go round. I'm just sorry, I mean, nothing goes without women. So I feel so proud. Women of color, they're standing up, holding these positions, and women are having voices now. So I mean, I think the more and more we continue to fight and stand on their backs and keep forcing them and keep pushing them and keep advocating for women, then they would see better and they would do better. Because again, I mean, when it all boiled down, whether you're a woman or a man, you had to be birthed by a woman. So again, if you were a father, if you're a husband, you have seen your aunt, your mother, your daughters go through pregnancy. So again, how did you get here? You had to be birthed by a woman. So again, I mean, I feel so proud that women are powerful enough to stand up, to hold these positions, to fight for us and stand with us and stand with not only Bella Balance with unions, Teamsters, to stand together for the working class, so that we can have living wages and we can have rights, and so that we can get, so that we would be able to be treated as humans and not as robots. Because again, we are human and we do make the world go around. So I feel proud that women are standing up and holding these seats and we can go forward as long as we keep fighting, keep advocating so that this would not happen again. So yeah, this is very much important, very much important.
And to harp on that, on what Tasha's saying, it is 2021. We are not living in the early 1900s where it seemed very normalized to have pregnancy complications because our medicine was not developed in that way. But we have no excuse now, right? We have no excuse as to why these statistics are as rampant as they are. And in fact, part of Obamacare is the idea that hospitals are actually given praise for the least amount of complications a hospital has, right? So it's in everyone's best interest, because when you think about hospitals as institutions, the way we think of prisons, and not everyone's interests are aligned, right? We have to understand that, and that I think is a huge issue, especially in the medical field. We see that root canals are the most commonly the most common procedure in all of dentistry, right? But root canals aren't necessarily always the right way to go about it, right? Everyone's out to make a dollar. So, and as we know, a lot of doctors are paid more money for C-sections, right? And a lot of doctors bully Black women into that situation. So why bring this up about Obamacare? Because it is now, they flipped the script on these hospitals to say, the less complications you have, the better ranking your hospital will be, right? So it is now in everyone's interest that we are saving lives and affording just actual plain and simple care to these women. It's not, we're not talking about a rare form of cancer here. We're talking about childbirth, one of the oldest, most natural things women have done from day one. And as Tasha said, every single person on this planet is from a woman. So, I think now that social media is as big as it is, and there are advocates for this issue everywhere. I think that is also what's helping bringing this issue to the forefront and making it a priority. I think people are sick and tired of seeing their loved ones die from complications that can be prevented. And I think women now more than ever are just sick and tired. So, there's a few different things, obviously, that have, come together in the harmony of kind of making this a big deal, because it is a huge deal.
Yes, and to draw upon where you're saying that it really is a win-win for everyone, it benefits everyone. I mean, the same idea that it benefits a company if they have a healthy employee, and
Absolutely.
if the baby is born not in the NICU, which, I mean, think about how expensive that is. Not only financially, but emotionally, of course, too. So we have seen business support. In favor of things like the Pregnant Workers Fairness Act, talking about this helps us keep our talented, female employees. It makes sure that our employees are healthy, and it actually gives us guidance around a really complicated area of the law. So I think that, there are these examples of concrete policy solutions that are win-win, win for everybody, and that we really should be doing and taking head on. And we can follow the leadership, like you were saying, Tasha, of all of those amazing, women of color in office. It's been great to see, and thank you for your comment. So there may be moms, watching who blame themselves for something that happened during a pregnancy, or because they suffered financially to support their families, when actually, as you said, Tasha, our country is lacking the support system they need. And what would you say to them? And I'll say one thing quickly to start us off. If anyone is watching who has a question about your rights, I hope that you'll visit A Better Balance's new Workplace Rights Hub. You can go to abetterbalance.org and click on Know Your Rights, or you can always call our free and confidential legal helpline at 1-833-NEED-ABB. But Tasha and Hannah, what would you say to a mom who might be watching and blames herself?
Well, I feel her. I can feel her because I blame myself for a while. I mean, when I had two boys, it's like all my boy, all I had two boys. All my kids is 8 years apart, and that's how I know that my child would be 8 years old if he or she had have made it. But I did blame myself, and because once you become pregnant, everything goes through your mind like, I don't need another child. This job, I'm working, I can't. I mean, you do blame yourself, and you get to thinking, should I have? You start putting your other things before yourself. So I would definitely tell women, please do not blame yourself. It's not your fault for you trying to take care of yourself as well as your family. And also don't be afraid, because I'm not afraid. I'm not ashamed, and we're not defeated. We go through things, and I feel like long as God give you breath in your body, you have another day to fight. So that's the reason why I continue to fight, and I will continue to fight so that our babies can stay alive, stay healthy, as well as their mothers. So again, please don't feel ashamed. Don't blame yourself. I mean, it's hard, but I mean, with the help of your family and the help of organizations like Better Balance and people that's out there to help, please reach out, and it will make you stronger. It will help you and also make you stronger. So I thank you.
100%. And I would also say that, guilt and trauma manifest themselves in the body, right? And they are things that will fester and grow if they are not treated properly. So anyone who is feeling that guilt or that trauma, I urge you to find someone to speak to, whether it's a friend or a professional. suffering in silence is part of that issue of harboring that grief and that trauma and that guilt. And it's natural to feel like it's your fault, but in reality, it's not. It's not your fault. You can, I remember when I suffered my miscarriage, so many people said, well, it's nature's way of saying that maybe there's something wrong with the baby, or, all of these anecdotes that people are quick to give you to give some reassurance. At first, they are not met openly. I think it's hard for any mom who's gone through this, or any woman who has gone through this knows that. But at the end of the day, you do start to have to tell yourself something in order to start to move past it. Because if you aren't able to confront these issues that harbor inside you, they will stay and they will fester and they will grow. And we unfortunately, we cannot live our lives that way. And yeah, so it's just, there's so many things, but it's not your fault. You're not alone. And it's really important to talk about your experiences, because the collective experience is one that's going to help us turn that guilt into action.
Thank you so much. Thank you both so much. So last question. It is 2021, and we've heard how important this issue is, how pervasive it is, and how pregnancy discrimination impacts the most vulnerable among us. How do you hope that the folks watching this conversation bring this back into their own lives, into their communities, and join the long overdue fight to end pregnancy discrimination by passing the Pregnant Workers Fairness Act this year? And again, the Pregnant Workers Fairness Act would provide reasonable accommodations like a stool, a water bottle, a temporary break from heavy lifting, extra bathroom breaks, things like that, so that workers can stay safe and healthy on the job. So how do you hope that folks watching this conversation can join us in that fight? Either one of you, feel free to go for it.
I mean, again, I think it's about really telling your story, and because at the rate of how many women are experiencing this, we all know someone who knows someone who has been through it. So I think really it's about telling your story, and it will resonate, and you are not alone. And therefore, like, the time is now to act. If it's not even a big lift on our part as the community to get the word out, right? Whether it's a tweet or a phone call to a senator or a written letter to a hospital, like, everything matters and all of the things count, right? So I would urge people to look at their community centers, go to your website for At a Better Balance, find these organizations that are doing work in communities, like, for instance, Saving Mothers organization, Every Mother Counts organization, who want to get involved. I mean, it could be as easy as sending out an email to 5 of your girlfriends, and each one of those people send out an email to 5 of their friends. I mean, that has a profound effect. So I would just say that, there's no shortage of places to start. There's no shortage of action to take. And, don't be afraid to bring this up over dinner. A lot of people say, leave the politics at the table. Well, you know what? At least this isn't a conversation about Trump. Finally, let's talk about something that's really affecting, the women that hold up this country.
Absolutely, absolutely. Just to piggyback on what you were saying, I mean, advocate. I mean, protest. Be loud, be proud. I mean, whoever you need, whoever door you need to knock on, whoever phone you need to ring off the hook, be loud, be proud, protest. I mean, because a closed mouth don't get fed. I mean, because again, we got to stay loud, we got to stay proud, and we got to stay fighting.
Wow, thank you. Thank you both so much for saying that. And thank you so much for joining A Better Balance in this important conversation. Hannah Bronfman, Tasha Murrell, and Representative Lucy McBath. And for those of you watching, let those words be ringing in your ears that you just heard. I really hope that you will join us at abetterbalance.org to take action and call on your congressperson to pass the Pregnant Workers Fairness Act without delay. And you can learn more on our social channels as well about this important work. But thank you so much again to Tasha and Hannah for sharing your stories. I know how difficult it is. I absolutely recognize that. And we are just honored that you would do it with us here today.
Thank you for having me, Tasha. It was a pleasure to get to know you. Oh, you're just on mute.
Yes, ma'am. Yes, ma'am. Thank you so much. It was an honor to meet you, and I hope we see each other soon and
Absolutely.
some more. I mean, keep up the good work. I mean,
You as well.
So proud of you for sharing your story. I mean, it's very powerful, and I mean, thank you. Keep up the good work, and I hope to see you a lot soon. Keep fighting, sister.
Absolutely. You as well. And thank you so much, Elizabeth. Thank you for having us both today.
Thank
Absolutely.
you so much. Thank you, Ms. Elizabeth.